morning everyone. I am Kris and Baro. So now I will be talking about the COR pulmonale. So we have here the definition. So COR pulmonale, also known as right heart failure, is a condition that occurs when the right side of the heart become enlarged and strained due to high blood pressure in the pulmonary arteries and lungs. It is often a result of underlying lung diseases such as chronic obstructive pulmonary disease or COPD or pulmonary hypertension. Next is we have here the pathophysiology. So COR pulmonale, also referred to as pulmonary heart disease, develops in a response to chronic pulmonary hypertension resulting from the following. First is the diseases of the lung parenchyma, disorder of chronic or alveolar hypoxia, diseases of the pulmonary vasculature. So all of these diseases and disorder leads to hypoxia, which is low oxygen levels in the blood, and hypoxemia, which is low oxygen levels in the tissues. This happens when the diseased area or the lung is unable to deliver oxygen to the blood. So the pulmonary arterioles will then carry the unoxygenated blood away from the damaged or diseased area of the lungs towards healthy lung tissues. And then it becomes widespread. It will lead to hypoxic pulmonary arterial vasoconstriction. So the arterial vasoconstriction leads to decrease in pulmonary vascular bed or the vascular blood vessels of the lungs. Since arterioles from the diseased areas of the lungs vasoconstricted, the pulmonary arterial pressure from the right atrium to the pulmonary artery increases. Those increase in pulmonary vascular resistance or the resistance against blood flow from the pulmonary artery to the left atrium. So elevated pulmonary vascular resistance leads to pulmonary hypertension, which happens when pulmonary artery pressure is more than 25 mm mercury at rest or more than 30 mm mercury on exertion. This leads to increased right ventricular afterload, which is the amount of pressure that the heart needs to exert to eject the blood during ventricular contraction. So this also accentuates the pulmonic valve closure during the right ventricular ejection, which causes the abnormal heart sounds. So this will eventually lead to ventricular hypertrophy, wherein the right ventricular wall thickens in response to pressure overload. The heart's right ventricle will be too weak to pump enough blood to the lungs, leading to right ventricular failure. So venous pressure in the vena cavas will increase, which will lead to raised GVP, where blood goes back up from the superior vena cava, the distended neck veins. So this is also the same with the enlarged palpable liver due to the backup of blood from the inferior vena cava, causing hepatic venous congestion. So hepatomegaly itself increases pressure on the diaphragm, causing shortness of breath, what we call the dyspnea. Dyspnea is the most common symptoms and can also be due to cardiovascular limitations, which decrease oxygen delivery. It also increases pressure within portal vessels, causing ascites, where fluid collects in space within the abdomen. COR pulmonale also leads to increased capillary hydrostatic pressure throughout the venous system, causing systemic fluid retention or fluid buildup. So as the pressure increases in the veins, it pushes fluid into surrounding tissues and those pedal edema or edema of the lower extremities. And lastly, COR pulmonale leads to further impairment of blood circulation, and lesser and lesser oxygenated blood are circulated throughout the body, especially the peripheries, leading to cyanosis. So next is the diagnostic and the laboratory exams. So diagnostic exams for COR pulmonale may include imaging tests like chest x-rays or CT scans, pulmonary function test, echocardiogram, and blood test to assess oxygen levels. And next is the medical and surgical management for the COR pulmonale. So for the surgical management, so lung transplantation in cases where severe lung diseases is the primary cause of cor pulmonale, and lung transplantation may be considered as the last resort. This procedure involves replacing one or both deceased lungs with healthy donor lungs. Next is the bilateral lung volume reduction surgery, or the LVRS. This surgical procedure is primarily used for certain cases of chronic obstructive pulmonary disease, and it involves removing damaged or diseased portion of the lungs, which can improve lung function and alleviate symptoms. Next is the pulmonary thromboendarterectomy, or the PTE. If cor pulmonale is associated with chronic thromboembolic pulmonary hypertension, PTA may be performed. This surgery involves removing chronic blood clots from the pulmonary arteries to reduce pulmonary hypertension. And last is the atrial septostomy. In severe cases of cor pulmonale, especially when medical therapy is not effective, an atrial septostomy may be considered. This procedure involves creating an opening in the atrial septum to relieve right heart pressure. So next is the medical management. So we have here the diuretics. Examples include furosemide and spironolactone, which reduce fluid retention to relieve symptoms of congestion. Next is the oxygen therapy. Supplemental oxygen is a key component, especially in cases of hypoxemia, to improve oxygen saturation. Next is bronchodilators. Medications like albuterol or tiotropium may be prescribed if cor pulmonale is associated with obstructive lung disease like COPD. Next is the anticoagulants. Warfarin or newer oral anticoagulants may be used to prevent blood clots formation, especially in cases where there is an increased risk of thromboembolism. Lastly is the vasodilators. In some cases, vasodilator therapy such as sildenafil or other phosphodiesterase inhibitors may be considered to reduce pulmonary vascular resistance. It's important also to note that the choice of medication and their dosages should be determined by a healthcare professionals based on a thorough evaluation of the individual's condition and underlying causes of cor pulmonale. Next is the nursing management. So first is oxygen therapy, administering oxygen to maintain adequate oxygen levels in the blood, which can help reduce strain on the right side of the heart. Next is medication management, monitoring and administering medications as prescribed by the healthcare provider, which may include diuretics to reduce fluid buildup and medications to dilate pulmonary arteries. Next is respiratory support, assisting the patient with breathing techniques such as deep breathing, exercises, and using incentive spirometry to improve lung function. Next is fluid and sodium restriction, monitoring and regulating fluid and sodium intake to prevent fluid overload, which can worsen the condition. Next is education, of course, providing patient and family education on the importance of medication adherence, lifestyle modification, and recognizing signs and symptoms of worsening cor pulmonale. Next is monitoring, frequent monitoring of vital signs, oxygen saturation, and fluid balance to assess the patient's condition and response to treatment. Next is positioning, encouraging proper positioning such as elevating the head of the bed to help with respiratory effort and reduce venous return to the right side of the heart. Lastly is the emotional support, so offering emotional support to the patient and their family as living with cor pulmonale and managing chronic lung diseases can be challenging. So that would be all. Thank you for listening.